Alright, so MEN stands for multiple endocrine neoplasia. And basically, MEN describes a few syndromes where, if we were to just speak plainly, there are many tumors in endocrine organs. And they can be benign or cancerous, and there are 3 subtypes, which we'll discuss in a little bit, and they're all inherited in an autosomal dominant pattern. Alright, so let's review the relevant organs of the endocrine system. And keep in mind that this list isn't comprehensive. We're just talking about the particular glands that are relevant to MEN. So the first gland that I just want to point out is the pituitary gland, which you'll find in your brain. And I'll bring up the little picture that I've drawn here. And highlighted in blue here is the pituitary gland, which just sits kind of in the frontal part of the brain. Next, there is the thyroid gland, which you find in your neck, which you can see here, just drawn in pink. These are the 2 lobes of the thyroid. Next up are the parathyroid glands, which are embedded within the thyroid gland. And the para in parathyroid actually means beside. So we'll show you what that looks like here. This is just kind of a zoomed up image of the thyroid, and then these 4 parathyroid glands are just embedded within the thyroid. Next up is the pancreas, which is in your abdomen. And here I've just drawn a little schematic of some of the organs that you'd find around the pancreas. And so here's the liver, here's the stomach, the gallbladder, and then the pancreas kind of sits in between the stomach and the beginnings of the small intestine. And then finally, I just want to point out the adrenal glands. And the adrenal glands are just 2 glands that sit on top of each kidney. And so here I've drawn the kidneys in red, and then the adrenal glands are in the pale yellowish color sitting on top of the kidneys. And so each of these glands are responsible for secreting various types of hormones, and thus they're considered to be part of the endocrine system. So now let's talk about the first subtype of MEN, and that would be MEN1. So the MEN1 gene is actually a tumor suppressor gene that codes for a protein called menin. Now, people with MEN1 usually inherit a defective copy of the gene at birth, and then a second mutation in the remaining allele results in a loss of function of the MEN1 gene in these cells. And this allows them to divide with little control and thus form tumors. And so these patients tend to form tumors in 3 characteristic areas. The first being in the pituitary gland, the second being in the parathyroid gland, and the third area being in the pancreas, which can manifest in the form of Zollinger-Ellison syndrome and selenomas, VIPomas, and rarely glucagonomas. And sort of a key association to know with MEN1 is, and this will often show up in question stems as sort of a hint as to what you should be thinking about, is that these patients will also have kidney stones, which is due to the parathyroid tumors that alter calcium and phosphate levels. And then they will often also have ulcers, which are due to the pancreatic lesions that lead to, say, Zollinger-Ellison syndrome, which stimulates the acid-secreting cells in the stomach. So that's the basic overview for MEN1. Now let's move on to MEN2. So MEN2 is caused by a mutation in a proto-oncogene as opposed to a tumor suppressor called RET. And this codes for a receptor tyrosine kinase that plays a role in signal transduction. So unlike MEN1, which is a loss of function mutation, MEN2 is an example of a gain of function mutation, which results in a constitutive or continual activation of a gene and leads to uncontrolled cell division. And let's give ourselves a little bit more room here since we're running out at the bottom. Alright, so there are actually 2 subtypes of MEN2. There's MEN2A and MEN2B. So the 3 types of tumors that are characteristic of MEN2A are medullary thyroid carcinoma, pheochromocytomas, which are tumors of the adrenal gland, and parathyroid tumors. And then the 3 types of tumors that are characteristic of MEN2B are also medullary thyroid carcinoma, which I'll just abbreviate here, medullary thyroid carcinoma as MTC, and pheochromocytomas, which I'll just abbreviate here. But instead of parathyroid tumors, these patients tend to form oral or intestinal neurofibromas, which are benign nerve cell tumors. And then MEN2B also has sort of a key association, the way MEN1 is associated with kidney stones and ulcers. But in MEN2B, these patients will be described as having a marfanoid habitus, which is just a constellation of symptoms that resemble those of Marfan syndrome, including, say, long limbs, arachnodactyly, and hyperlaxity of joints. And so there's your overview for MEN syndromes. You have MEN1, which is associated with pituitary, parathyroid, and pancreatic tumors, and then MEN2A and 2B, which are associated with medullary thyroid carcinomas and pheochromocytomas, and then MEN2A with parathyroid tumors, and then MEN2B with neurofibromas.